Hi, I'm Dr. Lisa Palmer, and I'm here with Systemic Formulas for mommy travel tips. It's one of the most common questions that I get from my patients that are traveling with their babies, their children, and their adolescents. What do you do? What do you pack when you travel to keep the family healthy, safe, and happy? This is one of my favorite products. I always travel with. It doesn't even go in the suitcase, it goes in my purse. This is woo oil. And there's so many things that you can use when you're traveling if this was the only thing you were to bring. But of course, I'm going to go over several products that you could bring with you, and then you guys can pick your favorites. But these are all my suggestions. So, woo oil is awesome to bring with you on trips. It's awesome to have with you in your purse or in your pocket or in your car, in your suitcase. What you can do is say that you're at the beach and you get bit by these little annoying bugs that we have on beaches called no-see-ums. They're little bugs because you can no-see them. You can't see them, but they bite you and it's not fun. You can dab your finger on here and dab that on those insect bites, and it'll help the insect bites heal. It'll help so they're not red. It'll help so they're not itchy. With that, you can, when an insect bites you, they can inject a bacteria or virus or fungus into the bite, which makes it red. It can get pussy and just not fun. So as soon as someone gets bit by an insect, you can put a drop of this on that bite, and it really helps. So it's very useful. Another use for this is upset tummies. So you guys are traveling, your kids and your family are eating different types of food. Maybe they have an upset stomach. You can put a drop of this on their stomach, and it can come down an upset stomach. Clogged sinuses, you go to a different time zone or you go to a different elevation. Like we go to travel we go from sea level here in Florida, when we go up to awesome mountains of Park City, Utah, which we'll be doing very soon this year. You might have some clogged sinuses as your sinuses are trying to adapt to a different atmosphere. So you can apply a little bit of the woo oil on your sinuses or on behind your ears, especially for clogged ears from congestion. Stinky situations, you're traveling in the car and someone had some food that didn't agree with them and they have a little bit of gas. A drop of this on a Kleenex and kind of bring it around the car can help clean up the air so it doesn't smell unpleasant. Also for bad breath, so you can put a little drop on your tongue for bad breath, or a stinky bathroom. You're in the restroom, it just doesn't smell well, or unpleasant smells anywhere. A little drop of woo and just put it around. It's such a powerful peppermint, spearmint oil that'll smell much better. Bad breath, a little drop on the tongue gets rid of coffee breath or funky breath. And then migraines. So if you suffer from headaches or migraines, or so does your family, you can put a little drop of the woo wherever the migraine is located, and that can help alleviate the symptoms of migraines. Who wants to have a migraine while you're on vacation? My next favorite product for my mommy travel tips is this product. This is amazing. This is called Skin Coloniser. And Skin Coloniser is the only probiotic that I am aware of in the whole entire world for the skin. Anything skin related. So you travel to a different area and your skin gets really dry, you can use it as a moisturizer for your arms, your legs, your body, your face. Chapped dry lips, you can put it on your lips. You can use it for, you say you're out in the sun and you get a little extra sun, you can put it on sunburns. This is just a super amazing product. It's also really good for patients or family members that have eczema. So our psoriatic, any kind of dry patches, that could really help with that, because not only it's not just contains good oils for the skin, but it actually, just like you have probiotics for your gut health, these are the only probiotics that I'm aware of for your actual skin. When a mommy kisses her kid or her baby, she's transferring good bacteria from her mouth to the baby's skin. And so that's how the baby's immune system is built up. So just like our gut has an immune system and has good bacteria and so on, so does our skin. So Skin Coloniser, always in my purse, always travel with it. Do keep in mind, if you're going to come down to Florida and it's hot, this is going to get very liquid, and you want to try to keep it out of the heat because there are live probiotics in it. And then if you go to a place where there's snow and it gets pretty cold, your oils are going to get a little bit thicker. It is normal. There's a little bit of grit in here. That is normal to have. That the product is that is normal for the product. And then it smells amazing. It smells like vanilla. So you could use this also. It's great for your skin. Oh, ladies, it's great for anti-aging. So you could put it below the eyes. So if you are looking for a moisturizer, so if you have patients that are using stuff from the supermarket, what is in it? Well, one of the main bases of regular skin lotion or moisturizer is petroleum products. Those are not healthy for you. Those are cancer causing. This would be a better option. So even if you put them on your shelf and every single person that wanted a skin lotion, this would be a way, way healthier option. And it would also promote good probiotics for the skin. So Skin Coloniser, definitely coming with me on any trips. Also, it's something that you will find in my purse right now. Okay, GA. So GA, we use so much GA that I actually don't have any on my shelf. GA is for adrenal stress. If you're thinking about packing and then you have to get through airport security and get to the airplane on time and all those things, a lot of people have a lot of stress before their trip. So it's kind of ironic. They're going on vacation because they want to have less stress and they want to relax, but then they're like super stressed out right before their vacation. So if you remember, the adrenal glands are located above the kidneys and they make hormones for stress. GA adrenal helps to support the adrenal glands. One of the signs that the adrenal glands are under stress is people start to get back pain. So doctors of chiropractic, you might have a lot of patients in your practice that have back pain and you're helping them through wonderful chiropractic care, but they really do need adrenal stress support as well. So if you muscle test, you can put the GA adrenal on them and just test. And if it's strong, they need it. And you can start giving them dosage based on what they dose for if you do nutritional response testing, where you can put the dose in the hand, or you can just read the bottle and give them whatever the bottle says. But it's great, great support for the adrenal. So GA adrenal, a great thing to travel with. One of those things that's also in my purse. And yes, there's a lot of things in my purse. People make fun of me until they need it, but something that you would want to bring on your trip. VRMs. Okay. So we have Verum 1, Verum 2, and Verum 3, Verum 4, and the numbers correspond to the sizes. And of course, each formula is a bit different. Verum 1 and 2 are for larger size parasites, and Verum 3 and 4 are for medium to smaller size parasites. If you do any kind of muscle testing and say that you're traveling on a trip and you had the most amazing sushi or you had beef tartare, so both of those dishes are dishes that could not be, they're not cooked. So beef tartare is raw beef sliced very thinly. And sushi could be cooked or not cooked. So if it's not cooked, you may get parasites from that. You can also get parasites from walking barefoot, from swimming in lakes, rivers, and oceans, from improper food handling, from the air, from animals. I mean, it's really, really, really common. And your gut microbiome is more sensitive to if you're not in your environment. So I'm from Florida. I'm pretty used to this environment here. But if you take me and you put me somewhere else, my system's not used to the bugs there. Great example is I just had a whole bunch, I had a patient and her family, they all went to El Salvador. And she's not from El Salvador. And so she went to go visit her grandma, and her grandma made everybody these shakes using water from El Salvador and fruit from El Salvador. And she felt really bad because the whole entire family that was from Florida drank the shake and they all ended up with diarrhea. Some of them had vomiting. The good thing is my patient had this, so she had a little bit of, her stomach was upset, but she never fully had vomiting or diarrhea. The Verum 1, if there was that size parasite in there, was protecting her from having a parasite infestation, whereas the rest of her family had a rough time. If she had seen this video, she would have been like, okay, good, I'm going to give my family Verum 1. And that way, if there's a parasite there, it's going to go ahead and take it. And then, of course, she can bring the family in and I can test them and see if that was the exposure. But the grandma didn't get the vomiting and the diarrhea. Why? Because grandma's microbiome is used to that kind of parasite. She's from El Salvador. She lives in El Salvador. She drinks the water. She's in that environment. So her body's already used to and knows how to handle that kind of parasite. So that's where you hear people going down to Mexico and they get Montezuma's revenge, which is unpleasant, right? So diarrhea, vomiting. You can try the VRMs. If you muscle test, you can muscle test for the exact right size. If you do nutrition response testing, you can actually test for the exact right vial, and then you'll know which one to use. If you have no idea, you can just take it, and if you're not pregnant or breastfeeding, and then this can help with diarrhea, vomiting, food poisoning, all that yuck. All right, so that's the VRMs, 1, 2, 3, and 4. Bactrex. Love Bactrex. Bactrex has saved me and my patients from so many different things. Really good for immune challenges that are bacterial related. So if your family members are exhibiting some kind of symptoms of some kind of cold, runny nose, sneezing, coughing, feverish, that kind of thing, it could be something that Bactrex would help with. If you do nutritional response testing, you have the bacteria 1, 2, 3, and 4 vials. If they test for that, see if Bactrex will help them. How do you know? You place Bactrex on the body, you test. If it tests strong, then their body's like, yeah, I like it. If you're familiar with nutritional response testing, there's also ways of checking for digestion, making sure that they're not allergic to it, and then actually testing the dose. So Bactrex definitely is going to come with me on trips. It's also in my, anytime I'm traveling, I have it with me. But when you use Bactrex, you also need to use, and same thing with the VRMs, you need to use ACP or ACX. ACP is what we call drainage. So ACP has a really nice amount of vitamin A, vitamin E, and vitamin C and calcium in it. This is also something good if you just feel like, after being on the plane that your immune system's been compromised a little bit, you can take ACP. So if you're going to use Bactrex, you want to use ACP. ACP is like the drainage. It's kind of like a vacuum cleaner or a broom. This will help your body fight off the bacteria immune challenge. And then you have like dead bugs everywhere. This will help to sweep up the nasty dead bug bacteria particles. Because if you have a whole bunch of dead bugs from the Bactrex, that's when the patient really gets congested. They feel tired. It's a sign that the lymphatic system is clogged. Again, Bactrex for the bacterial immune challenges, ACP for the drainage. All right, good. Fungus. Okay, so Fungus, awesome product. You're traveling and you might have got exposed to mold, or maybe you kind of overdid it with the sweets, so too much ice cream or cookies or candy. That can make a yeast overgrowth and cause candida. So females, you might have vaginal itching or discharge. Males, you might have itchiness as well. Or you can get like yeasty rashes or bumps on the arm, coated tongue. Those are all signs that there's too much yeast in fungus. Fungus is great for that. So you can look from a practitioner standpoint and look at what the family member is exhibiting, or oh my goodness, well, I usually don't let my kid have cookies and they just had a whole pack of cookies, or they just ate a whole bunch of candy, or they had too much ice cream. And you can look for those signs and try Fungus. Again, with Fungus, so you're going to use it for fungus, yeast, and molds. If they were to test for this, you would also want to use ACP. So this helps your body handle the fungus and the yeast and the mold. This is going to help with the drainage getting rid of. Again, if I ruled the world, or if I could bring everything with me on my trip, Fungus would definitely be in my suitcase. All right, Vivier and Gold. All right, so we don't have Vivi, V-I-V-I. We don't have that in stock because it's been a crazy week here, so that's out of stock. But we do have Gold, so I would either have Vivi or Gold or both with me. Gold helps to boost the immune system. So you're traveling, sneezing, coughing, something's happening, you feel your immune system's compromised. If you do muscle testing, you can put the bottle of Gold on them and test. If it's strong, the body's like, sure, I love Gold. So you can use that for any kind of immune challenge, whether it's bacterial or viral. And then again, I'm going to sound like a broken record. If you're handling something for the immune challenge, you also want to give drainage. Okay, so this helps the body handle and kill off viruses and immune challenges. So then you have all these dead bug particles everywhere, causing congestion and just a feeling of yuck. Then the ACP will help with the drainage. The ACP will get that out of the system. So Gold, take Gold with you. Okay, so that's a lot if if your family gets sick while on vacation, which is the worst time to have a flu or a cold and ruining the vacation, you could be proactive about it. And in your mommy travel box or your daddy travel box in your suitcase, you have all these things. Bind. Oh my goodness. So bind, it's down here. Bind. Love it, love it, love it. Okay. So in bind, you have your activated carbon. And I always have bind on hand in both my restroom, my bathroom at home. I take it with me when I travel. Bind, or this is one of the things I advise patients on. If you, God forbid, you're out of town and you start having diarrhea or you have vomiting, it means that your body's trying to do what? Yeah, it's trying to get rid of something. So with bind, if you can take 2 every 15 minutes, it'll help absorb the yuck. If you do muscle testing, you can actually dose it. So you can put bind in the person's hand and see how much they need. They might need 5, 10, 15, 20 bind. One time it was a Saturday and my husband was out of town. Nobody was home and I just felt horrible. And I started having diarrhea. I just started eating bind. And after eating 15 of them, all the diarrhea was gone and I felt fine. So the bind helped absorb whatever toxins were in my system. So you definitely want to bring a nice fresh bottle of bind with you when you travel. And a rule of thumb is you could do 2 bind every 15 minutes while the vomiting and diarrhea is occurring. And that can help your body absorb the toxins, and then that stops. I think as healthcare providers, we have a responsibility, especially to our families, to be prepared. I don't know if you guys are like Boy Scouts or Girl Scouts, like you remember, be prepared. If you have stuff like this when you travel, you don't feel hopeless and you don't feel helpless. And you don't have to depend on a medical doctor or depend on an urgent care center to help fix your family. You can handle it yourself. And if you have knowledge of the systemic formula product line, then you know what to pack, you know what to utilize. And even if you're like, I'm not sure, you're not going to hurt them. Okay? Because remember, these are not made out of pharmaceutical drugs. These are made out of herbs. Okay? So bind, definitely want to have it when you're traveling. Now you know 2 over 15 minutes while the vomiting or the diarrhea is occurring. Worst case scenario, you just absorb some toxins. Best case scenario, that stops and you're off to go to the beach or the mountains or whatever fun thing you had planned that day. I don't know about you guys, but when I'm traveling, sometimes I have a hard time sleeping because I'm so excited to be in a new place, or the time zone is different from me. Just the body gets a bit out of rhythm. Dream is a sleep aid. Okay, so this is also really good for patients that are having problems sleeping. So they would take whatever they dose for. If you're doing muscle testing, you can dose to see what their dose would be. But please, please, please make sure that you tell your patients to take it right before bed. You wouldn't want to take it in the morning and then try to get through your day because you'd be sleeping. So 1 before bed or 2 before, right before bed, and then actually go to bed. So the DREM product would be great if you're jumping time zones. So say you're from the East Coast or you're going West Coast or vice versa. You're headed to Europe, you're headed to Hawaii, you're headed to a different time zone. DREM will help you so you can actually get the rest that you need to have an amazing time on vacation. Other tips that I wanted to share with you is a lot of patients will ask me, and people will ask me with new babies, how do you handle a new baby in an airplane? And that was one of my concerns when my daughter was young. She was 1 month old. My husband, my brother-in-law, got married. We're like, oh my goodness, we have a 1 month old and we have to get on a plane with her. What do we do? I don't want to be the mom with the screaming baby, because who wants to be that person? And then you definitely don't want your baby screaming. And I had a lot of attention on that. I was concerned that we would be the family where everybody's like, oh my goodness, can that baby stop crying? So hopefully you guys are interested in some baby tips. So baby tips, if you are nursing, try to delay the nursing for takeoff. Remember, in takeoff, the plane is accelerating and then gaining altitude. And you know as an adult, your ears will pop and you know how to clear your ears. So you can swallow, you can drink water yourself, you can hold your nose and push, and that will help clear the ears. But your baby doesn't know how to do that yet. So a sucking motion and a swallowing motion will clear their ears and keep their ears clear. If the ears get clogged up, that's when they get in pain and they start screaming and crying, and then it's just miserable for everyone. So try to delay breastfeeding until takeoff. Infants do not need to be in infant carriers. They do not need a seat up to a certain age range. In some airlines, that's to 2 years old. They do not have a seat to actually sit on you, which is good because you save money. As they get a little bit bigger, it can get uncomfortable. So some people do buy infants a seat and they bring their car seat. So whatever way you want to do that, but you can take them out of the car seat and you can nurse them. So the other recommendation I have for you is make sure you bring a big blanket, especially if it's just you and your husband and the baby, and then you have that person on the seat with you. It can be a little awkward breastfeeding. I know some of you mommies out there, you'll whip the breast out and no big deal, and you're like super cool with that. And then there's other people that are a little bit more shy. So you can bring a blanket, and that way you're covered, and the person next to you doesn't feel awkward or uncomfortable because your breast is exposed. I don't want to start a mommy fight, but whatever you want to do on that, a big blanket is awesome, especially since airplane flights can get a bit chilly. So breastfeed on takeoff, breastfeed on landing. Bring books, bring toys. When you're prepared and you have like a backpack filled with stuff for the baby, then you're all set. Bring food. So if your infant is 6 months or older, they might be having baby food. So you can bring baby food. But just the more prepared you are, the better. The other great thing is if you have an infant, you can bring bottled water through security. So the rule is interesting. So if you have bottled water, they won't let you bring it through. But if it's for your baby, then you're allowed to bring it through. Also, if you've pumped and you have breast milk in a bottle, you can also bring that liquid through TSA. You can bring that through airport security. So that's something that you should know. So that's really great. If your child is no longer an infant and you're trying to bring a water bottle through, you will not be able to bring it through. If it's a reusable water bottle, then you can dump the water, and then after you get through security, you can fill the water. So just a heads up, if you are traveling with an infant, you can bring breast milk. You can bring a bottle filled with liquid, and you also can bring water if it's for the infant. Okay, so there's all my infant tips for you. Toddlers. Okay, so toddlers still could be breastfeeding, so the same tips apply. If they're no longer breastfeeding, sippy cups, especially the sippy cups with the straw. Why? When they're drinking through the straw, that helps to clear the ears. Make sure that with a toddler that you burn off lots of energy. So sometimes I see families and they're waiting at the gate and they're making all the kids sit just to only get on the plane and then sit even longer. So your kid, maybe you can go to the park before you go to the airport, depending on the flight time, walk up and down the gate, show them cool stuff in the stores, but just keep them active because then on the plane they're going to want to rest, and then bonus points if they take a nap. Okay, so keep them active. Food, you want to have their favorite snacks. Try to stay away from sugary snacks, like your candy and your cookies and sugary juices. Why? One, sugar reduces the immune system. And on an airplane flight, your mucous membranes get very dry. You're more likely to get bacteria and viruses and funky stuff. Sugary juices could be stayed away from. You can use, bottled water. You can bring a water bottle and fill it after the gate. Herbal teas, those kinds of things would be healthier. Broth would be awesome if you could find it once you're past the gate. But if you try to bring broth in before TSA, they would probably make you throw it away because liquids are not allowed. Also keep in mind any kind of liquidy things like peanut butter or hummus or yogurt. If you have that pre-TSA, they will make you throw it away, which is a super bummer. So after TSA, some airports do have healthier options, but you could bring, slices of turkey. You could bring any kind of fruit. You could bring almonds. You could bring, there's a company called Simple Mills makes almond-based crackers. So you could do that. Whatever your favorite snacks are, and then even some special treat snacks, not sugary, but something that your children typically don't get, and save it for on the airplane, not the gate. Save it for the airplane. So that keeps them occupied. It keeps them fed because we know that babies and infants and children that are well hydrated and well fed are happy, but ones that are hungry and have too much sugar will make your life way harder. Once the plane has stabilized and the fasten seatbelt light has been removed, I sound like a flight attendant now, and you're free to walk around the cabin. Now I really feel like a flight attendant. Do get up with your toddler and walk up and down the aisles as long as you're not causing any blockages in the aisles. And that way they can burn off some energy as well, especially if we're talking about an overnight flight, like a European flight or maybe a coast to coast flight. Once you get at your destination, find a health food store. So for us, we pick destinations and we pick hotels on purpose because they're close proximity to a good health food store. So on your plane, you have your reusable bag, your freezer bag with a hard ice pack. You can't bring the squishy ice packs, or TSA will take those. So you have your hard ice pack with any kind of foods. And then once you get to your destination, if you can choose a hotel which is close to a health food store, then you can go shopping again and you have snacks for your whole entire trip. Even better, you can choose a hotel that has a kitchenette with a full refrigerator and oven. So you can prepare meals that are healthy for your family, breakfast, but who wants to cook all the time? So then you can look for farm to table restaurants. And what that means is that that chef is looking for foods that are seasonal, meaning that the farmers in the area are growing those vegetables at that time. And oftentimes they're using local meats, so grass-fed meats like beef or chicken. If you're by a coast or by water, perhaps cold water fish like rainbow trout or saltwater fish could be consumed because you're getting it fresh. So the fresher, the better. So one of the things you can look for is farm to table restaurants. And you can search that on Google. You can search that on Yelp and even get ratings on what people think about it. Another option could be steakhouses, because again, you have the option of proteins and vegetables. So those tend to be healthier options, or seafood restaurants, because you can get fresh local seafood and have vegetable options. Traveling is not an excuse and does not mean that you have to eat bad food. A lot of patients will tell me, oh, well, Dr. Palmer, I was traveling, there wasn't any food. Well, I know about this city. I know about Orlando, and I know how many places there are to shop and eat. And most major cities are the same exact way. It's just preparation. Now, if you do want to consume, a treat like a healthy cookie or not a healthy cookie or have alcohol or those things, that's totally fine. It doesn't mean you have to be perfect on your diet all the time, but just know that you may compromise your immune system. And just know that if you're giving your kid a whole bunch of chocolate or sugar or whatever the case may be, and they start to get super hyper, well, that's what happens after sugar. So just, some things to keep in mind. You want to be on vacation and enjoy your vacation, but not crash yourself, not make yourself sick, or cause your children to be so hyper that they're not so much fun to be around. Airbnbs are another great option because you can have a whole house or a whole apartment or a whole condo to yourself. You can have a full kitchen and stock the fridge, and it gives you a little bit more flexibility. Sometimes the owner is present, so you can ask them, hey, what's really good, fun thing to do in your city, or where's a good museum to go, or where's a good park to go. So they have knowledge. It's kind of like you have your own concierge. And then a lot of times they have fun things too. So they'll have like beach chairs or beach toys, or they'll let you borrow bikes, or let you borrow surfboards, or let you borrow ski equipment. So Airbnb just has a whole other level of things that you could do. And then water. So you definitely want to have water with you. If you have a reusable water bottle, again, before you fly, before you go through TSA, you have to dump the water. And then after security, you can fill the water at a water fountain. Or you can buy bottled water after you get through security. And then once you get at your destination, we like to buy a case of water. We love Mountain Valley because it comes in glass, so you're not absorbing the plastics. And you can put a case in your trunk or put a case in the back of your vehicle, and now you guys stay hydrated the whole entire time. Otherwise, you get super thirsty or you're just looking for something to drink, and then you end up at a vending machine. Luckily, there is water options in vending machines, so it's just easier for travel. So we've talked about supplements that you can bring and you can pack. Those supplements I would recommend putting in your carry-ons, and God forbid your luggage gets lost, you still have your supplements. We talked about different tips for infants in travel, children in travel, and then once you get at your awesome, amazing destination, options for food and options for hotels and Airbnbs. I hope these mommy travel tips have been super helpful for you. I hope that you continue to use your knowledge from systemic formulas and help your patients. And I hope that you use these mommy travel tips, and you can apply them for not only your family, but also your patients. And you have an amazing trip. And I look forward to seeing you in Park City, Utah at the next Systemic Formulas event. Bye.